Imagine this: a healthy man in his 20s or 30s suddenly faces a moment where his body simply refuses to respond. The mind is ready, the situation feels right, but the erection does not happen. For many men, this moment creates panic, embarrassment, and a silent question: what is wrong with me? This condition is called erectile dysfunction, often abbreviated as ED. It refers to the consistent inability to achieve or maintain an erection firm enough for sexual activity. The key word here is consistent. Almost every man occasionally experiences difficulty with erection, especially during stress or fatigue. That temporary situation is normal. Erectile dysfunction, however, occurs when the problem repeats over time and begins affecting confidence, relationships, and emotional well-being. Before understanding anything else, it is important to know what an erection actually is. Many people think it is purely a sexual reaction, but in reality it is a complex biological process involving the brain, hormones, nerves, muscles, and blood vessels all working together in perfect coordination. When a man becomes sexually stimulated, the brain sends signals through nerves to the penis. These signals trigger blood vessels to relax and widen, allowing a large amount of blood to flow into the erectile tissues. As these tissues fill with blood, the penis becomes firm and erect. At the same time, veins tighten to keep the blood trapped inside, maintaining the erection. Now here is the surprising part that many people do not realize. An erection is actually more about blood flow and nerve signals than about sexual desire alone. A man can feel attraction or excitement, but if the body cannot complete this internal process, the erection may still fail to occur. This is where erectile dysfunction becomes confusing and frustrating. Many men think it means they have lost masculinity or sexual ability, but medically it simply means that somewhere in this chain of signals, from the brain to the blood vessels, something is not functioning the way it normally should. Here is another fact that surprises many viewers. Erectile dysfunction is far more common than people think. Millions of men across the world experience it at different stages of life. Yet because of embarrassment and social stigma, most never talk about it openly. They remain silent, assuming they are the only ones facing the issue. And that silence creates a dangerous cycle. The moment a man experiences erection difficulty once or twice, fear starts building in his mind. The next time intimacy happens, he becomes hyper-aware of whether the erection will occur or not. That pressure alone can make the body even less responsive, turning a temporary issue into a repeating problem. Another important point many people misunderstand is the difference between libido and erectile function. Libido refers to sexual desire, the psychological urge for intimacy. Erectile function, however, refers to the physical ability of the body to produce and maintain an erection. A man can still have strong sexual desire but struggle with erectile performance, which is why the experience can feel so confusing. Erectile dysfunction can also vary in different ways. Some men can achieve an erection but cannot maintain it long enough for intercourse. Others may experience erections during sleep or early morning but struggle during sexual activity. In some cases, erections become weaker than usual. These variations are all considered forms of erectile dysfunction when they occur repeatedly. One of the most misunderstood aspects of ED is age. Many people believe it only affects older men. While it does become more common with age, younger men are increasingly reporting erection problems as well. Because of this misconception, younger men often feel even more shocked and ashamed when it happens to them. The emotional impact of erectile dysfunction is often just as significant as the physical experience. It can affect confidence, create relationship tension, and lead to feelings of inadequacy. Some men begin avoiding intimacy altogether because they fear another moment of failure. But here is something crucial to remember: erectile dysfunction is not simply a personal weakness or a sign of lost masculinity. It is a medical condition involving the body's natural systems. Understanding what it truly is removes the shame surrounding it and replaces it with knowledge. And this is only the surface of the topic. Because what many men do not realize is that erectile dysfunction rarely appears without a reason. In fact, the body is often trying to signal something deeper. And that brings us to an important question. If erectile dysfunction is not just about sexual performance, what exactly is the body trying to tell us? Many men believe erectile dysfunction appears suddenly and without explanation, but in reality the body rarely malfunctions without a reason. Behind most cases of erectile dysfunction, there are underlying factors quietly interfering with the complex system that allows an erection to occur. These factors generally fall into three broad categories: physiological causes, psychological causes, and pathological medical conditions. First, physiological causes involve the body's normal biological functions that influence sexual performance. An erection depends heavily on healthy blood circulation. If blood flow to the penis becomes restricted or inefficient, the erectile tissues cannot fill properly. Conditions that affect the vascular system, such as high blood pressure, elevated cholesterol levels, or reduced vascular elasticity, can significantly impair this process. The penis contains very small arteries, much smaller than those supplying the heart, which means even minor circulation problems can quickly affect erectile strength. Hormones also play an essential physiological role. Testosterone is the primary male hormone responsible for sexual desire and overall sexual function. When testosterone levels decline, men may experience reduced libido and weaker erections. Hormonal imbalances can occur due to aging, metabolic disorders, obesity, endocrine gland dysfunction, or chronic illnesses that disrupt hormonal regulation. Another physiological factor involves the nervous system. Sexual arousal begins in the brain, where psychological stimulation triggers nerve signals that travel down the spinal cord to the pelvic nerves. These signals instruct blood vessels in the penis to relax and expand. If these nerve pathways become damaged or disrupted, the communication between the brain and the penis weakens. Neurological disorders, spinal injuries, or nerve damage can therefore directly interfere with erectile function. Now consider psychological or emotional causes, which are extremely common yet often overlooked. The brain is one of the most powerful organs involved in sexual performance. Mental stress, anxiety, depression, and emotional tension can interrupt the brain's ability to initiate and maintain the erection process. When a person feels anxious or fearful, the body releases stress hormones such as adrenaline and cortisol. These hormones prepare the body for survival situations, not intimacy, and they constrict blood vessels while suppressing sexual responses. Performance anxiety is one of the most frequent emotional contributors to erectile dysfunction. A single episode of erection difficulty can create fear of repeating the same experience. That fear produces pressure during future encounters, which activates the body's stress response. Instead of relaxation and arousal, the nervous system shifts into alert mode, preventing the natural erectile mechanism from functioning properly. Relationship dynamics can also play a role. Emotional disconnection, unresolved conflicts, communication problems, or lack of trust between partners can subconsciously reduce arousal. Even when physical attraction exists, psychological barriers can block the mental signals required for sexual stimulation. Depression presents another powerful emotional factor. Individuals experiencing depressive symptoms often report reduced sexual desire, low energy levels, and diminished motivation. In such cases, erectile dysfunction becomes part of a broader psychological struggle rather than an isolated sexual issue. The third category involves pathological medical conditions. These are diseases or structural abnormalities within the body that directly affect erectile mechanisms. Diabetes mellitus is one of the most significant examples. Chronic high blood sugar damages blood vessels and nerves throughout the body, including those responsible for erections. Over time, this damage can reduce sensitivity, impair blood flow, and weaken erectile responses. Cardiovascular disease is another major pathological contributor. Because erections rely on healthy vascular circulation, any condition that narrows or blocks arteries can reduce blood supply to the penis. Interestingly, erectile dysfunction often appears years before symptoms of heart disease become obvious, making it an early clinical indicator of vascular problems. Certain neurological disorders can also produce erectile dysfunction. Conditions such as multiple sclerosis, Parkinson's disease, stroke, or spinal cord injuries interfere with nerve signaling pathways essential for sexual function. When these signals fail to reach the erectile tissues, the normal erection process becomes disrupted. Medications may contribute as well. Drugs used for high blood pressure, depression, anxiety, or certain hormonal therapies can sometimes interfere with sexual function as a side effect. These medications influence neurotransmitters, hormones, or blood flow mechanisms that play roles in erection physiology. Lifestyle-related medical factors also fall within this pathological spectrum. Obesity, metabolic syndrome, and chronic inflammatory conditions alter hormone balance and vascular health. Over time they create an internal environment that makes erectile dysfunction more likely. What makes erectile dysfunction particularly complex is that many men experience a combination of these causes simultaneously. A physiological issue may trigger the first episode, which then creates psychological anxiety, while an underlying medical condition quietly worsens the problem. This is why erectile dysfunction cannot always be explained by a single reason. Instead, it often represents an intersection where physical health, mental well-being, and systemic diseases meet. But understanding the causes alone does not solve the problem. The next critical question many viewers are asking is this: if these are the hidden mechanisms behind erectile dysfunction, what can actually be done to improve or reverse it? At this point an important realization emerges. If erectile dysfunction develops from multiple physical, psychological, and medical pathways, improvement also requires addressing the body and mind together. The encouraging reality is that in many cases erectile function can significantly improve once the underlying factors are managed properly. One of the most powerful areas of improvement begins with cardiovascular health. Because erections depend heavily on blood circulation, anything that improves vascular function also supports erectile performance. Regular physical activity strengthens the heart, improves blood vessel elasticity, and enhances overall circulation. When blood vessels become more efficient at delivering oxygen-rich blood throughout the body, the erectile tissues also receive stronger and more consistent blood flow. Body weight and metabolic health also influence erectile function. Excess body fat, particularly around the abdomen, contributes to hormonal imbalance and inflammation inside blood vessels. As metabolic health improves, testosterone levels often stabilize and vascular performance becomes more efficient, which can gradually restore stronger erectile responses. Sleep is another critical but frequently underestimated factor. During deep sleep cycles the body regulates hormones, repairs tissues, and restores nervous system balance. Testosterone production is strongly linked to healthy sleep patterns. When sleep becomes chronically disrupted, hormonal regulation weakens and erectile function may decline. Restoring consistent, quality sleep often produces noticeable improvement in overall sexual health. Mental health plays an equally significant role in recovery. Stress, anxiety, and constant mental pressure keep the body in a state of heightened alertness. In that state, stress hormones dominate the nervous system, reducing the body's ability to relax and initiate the physiological process of erection. Practices that reduce chronic stress, such as relaxation techniques, breathing exercises, or mindfulness-based approaches, help shift the nervous system from survival mode into a calmer state that supports natural arousal. Addressing performance anxiety can be particularly important for younger men. When the mind becomes overly focused on the fear of losing an erection, that fear itself disrupts the brain's arousal signals. Psychological counseling or sex therapy can help break this cycle by restoring confidence, reducing pressure during intimacy, and allowing natural responses to return without excessive mental interference. Medical evaluation also becomes essential when erectile dysfunction is persistent. Because ED can sometimes signal underlying conditions like diabetes, cardiovascular disease, or hormonal imbalance, identifying and managing those conditions often leads to improvement in erectile function. Physicians may evaluate hormone levels, cardiovascular status, nerve function, and metabolic health to identify hidden contributors. In some cases medication specifically designed to enhance erectile function may be prescribed. These medications work by relaxing blood vessels in the penis and improving blood flow during sexual stimulation. When used under medical supervision, they can help restore the natural erectile process for many individuals. For men with hormonal deficiencies, testosterone therapy may be considered when laboratory testing confirms low hormone levels. Restoring hormonal balance can improve libido, energy levels, and sexual responsiveness when the deficiency is clinically significant. In situations where vascular or nerve damage is severe, additional medical treatments such as vacuum erection devices, injectable medications, or surgical implants may be recommended. These interventions are typically considered when simpler approaches do not produce adequate results. What becomes clear from all of this is that erectile dysfunction is rarely a permanent sentence. It is often a signal from the body indicating that something within the physical or psychological system requires attention. When those underlying factors are addressed with proper understanding and medical guidance, many men experience meaningful recovery of sexual function. Understanding the condition removes fear. Recognizing the causes reveals what the body is trying to communicate. And addressing those causes opens the path toward restoring both confidence and sexual health.